Dr. Sahana Shruthi, consultant, obstetrics and gynecology and fertility specialist. We are from Team Arudhra from Puducherry, creating awareness for the month of November on preterm labor. So, who are the patients who go in for preterm labor and what are the causes and the symptoms? I would like to give you what is preterm labor. Preterm labor can be considered as anything less than 37 weeks. In a normal pregnancy, we have around 40 weeks of pregnancy. But when it is less than 37 weeks, we consider it as preterm labor. What are the signs or the symptoms of a patient or a pregnant woman having preterm labor is when they have a dull backache, when they have abdominal pain, or when they have white discharge, or when the pH changes and the white discharge is associated with mucus, or when it is associated with any blood, then patient might go into preterm labor. How do we prevent preterm labor is by looking at the investigations and taking a vaginal swab and by preventing the infections for the pregnant women. Other than that, who are more prone to preterm labor will be the patients, like for instance when they have an IVF pregnancy, when they have been manipulated, their cervix has been manipulated many times, when there is a multiple pregnancy, all of these patients will be prone for preterm labor. So how do we prevent preterm labor, or how do we try and save the preterm babies? So what to do when we do have a preterm labor? So when we do have patients with preterm labor, we try and prolong the duration of the pregnancy. Like for instance, we try to keep the baby inside the womb as long as it's possible. This can be done with the help of something called medications, which are tocolytics, and other than that we also give something called steroids for the lung maturity. So how do we help these preterm babies not have any problems is by admitting them in the NICU and then giving them the utmost care. So in India at least, by around 28 weeks we try to get maximum. What do we do when we do have a preterm labor? So immediately please consult your gynecologist so that we can do as much as possible to save you as well as the baby. Thank you.